Hi, I'm Dr. Martina from Dentelli. Today's topic is composite veneers vs porcelain veneers. And when I say porcelain veneers, I usually mean the glass ceramic veneers that are the real veneers. So, composite bonding, yes, and we do it very often, but it has its own indications. Usually it's after braces, after aligners, when you want smaller changes to add to the tooth, to bond to the tooth the perfect color and material, and then you don't touch the tooth a lot, you don't drill it, you don't grind it down. If you have a small tooth, a micro tooth, let's say, then you want to enlarge it, let's say, then yes, also composite bonding. If you want to change the color with composite bonding, then it's very demanding because you have to grind off a lot of structure in order to add some layers in order to get a new color. And then usually we get a bulky result, you know, very chubby, bulky result. And I, as an esthetician, I really don't like it. And the minus side is also that you, after, you know, some while, it doesn't look so shiny anymore. Because, you know, with the toothbrush, it has some abrasive things in the toothpaste. You get the shine off, and they become kind of dull. And after a year or two, they can stain from the food, you know, the edges can become other colors. So it really is some compromise and temporary solution if you want a full smile makeover. Yes, in some situations, but for the full smile makeover, I would always choose the permanent solution in sense of porcelain veneers. And with them also you have to, you can grind very little. You can use the lumineers that are 0.1, 0.2, 0.3 millimeters. The classic veneers are 0.5, let's say 0.7 millimeters. But it really depends from the situation. If you have a tooth that is more to the back, then you don't have to grind anything. You just put a very, very thin veneer on it and you are in the perfect row. But you have a rotated tooth and you have a tooth standing out, and you want to fix it with veneers, you really have to grind it back, you know. This is the reality. So the patient should really be interested only for the perfect result at the end. If that means on some places to grind it a bit more, then he really should give the trust in the dentist that he will not do damage more than he has to do, and that the dentist is thinking a holistic approach to really preserve the tooth as much as possible. So very short, but my answer is in many cases I prefer the porcelain veneers, but yes, composite bonding and composite veneers can be a great solution, but this is something we should talk together through the situation.